Hello, everyone, and welcome to the Surveillance Advances Series 2024 to 2025 season. This seminar series is co-hosted by the Public Health Agency of Canada and the National Collaborating Centre for Infectious Diseases, or NCCID. The title for today's seminar is Canada's Surveillance Efforts for HPAI in Dairy Cattle and Beyond. My name is Robert Sager, and I'm research staff at NCCID, and I'll be your moderator today, along with Chayu Lin, who is a senior policy analyst in the Data, Surveillance, and Foresight branch of the Public Health Agency of Canada. The NCCID is funded by the Public Health Agency of Canada to provide knowledge and evidence for use in public health planning, programs, and policies related to infectious diseases. We are incredibly pleased to be co-hosting this series with the agency. Both Chayu and I are joining you today from the city of Hamilton, situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississauga peoples. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. Today, Hamilton is home to many Indigenous peoples from across the Turtle Island. We honor the Indigenous peoples who have lived on and cared for these lands for generations. We are grateful for the opportunity to share and care and call this place home. The Surveillance Advances seminar series has welcomed participants and presenters from coast to coast to coast since our inception in September 2023. While surveillance is the most common term used in public health to describe the process of tracking health events and determinants through the collection, analysis, and reporting of data, due to concerns over its connotations, some have suggested the use of other terms, such as public health assessment. We acknowledge that there is still an ongoing dialogue about the use of the term surveillance in public health. For the time being, without a widely accepted term in the literature, we would like to note that we use the term surveillance in the series title to refer to the assessment of and response to public health threats as a core function of the public health systems. And before we dive into today's seminar, there are just a few housekeeping items I would like to mention. First, a recording of the seminar and presentation slides will be available shortly after the seminar on the NCCID website. That's nccid.ca under webcasts. Second, the chat box for participants has been disabled for this session. The hosts will use the chat box to communicate additional information with you. If you have any technical problems with Zoom during the seminar, please email us at nccid@umanitoba.ca. And finally, please send in your topic-related questions through the Q&A tab, and we will address as many as possible in the discussion period after the presentation. You can like any of the questions to push them up in priority. We would also like to note that Surveillance Advances is a Section 1 self-approved group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. The seminar series is also approved by the Council of Professional Experience Professional Development Hours for members of the Canadian Institute of Public Health Inspectors. If you require a letter of participation for your attendance today, please look out for a survey that will be shared after the seminar. Before we begin, we would like to note that our speaker today, Dr. Murray Gillies, brings their own unique perspectives and subject matter expertise, which we are excited to hear and learn from. The Surveillance Advances seminar series values opportunities like this to explore diverse ideas and foster thoughtful discussions on emerging topics in public health surveillance. This being said, please keep in mind that the views and the work that Dr. Gillies will be presenting are their own and do not necessarily reflect the views or initiatives of the Public Health Agency of Canada. And with excitement, I would like to introduce and welcome our speaker. So today's seminar will be presented by Dr. Murray Gillies from the Canadian Animal Health Surveillance System. Dr. Gillies grew up on his family's dairy farm in Sussex, New Brunswick. He took animal science with a focus on agriculture at the Nova Scotia Agricultural College before completing his Doctor of Veterinary Medicine degree from the Atlantic Veterinary College in Prince Edward Island. After graduating, Dr. Gillies spent 2 years in New Zealand in a dairy-focused clinic before moving back to New Brunswick, where he worked for the government of New Brunswick for 5 years in animal practice. In September 2018, he joined the veterinary pharmaceutical company, Vitoquinol, as a technical services veterinarian, where he worked for 4.5 years. Dr. Gillies is the interim director of the Canadian Animal Health Surveillance System, a division of Animal Health Canada. Also, a past president of the Canadian Association of Bovine Veterinarians and the current District 12 Director for the American Association of Bovine Practitioners. Dr. Gillies is currently working on a master's in animal health management at the Atlantic Veterinary College with a project focusing on antimicrobial use on dairy farms. Dr. Gillies was the dairy subject matter expert for the Canadian Veterinary Medical Association's Stewardship of Antimicrobial Use by Veterinarians initiative in both 2018 and 2020. He remains very active in the day-to-day operations of his dairy farm. So, welcome, Dr. Gillies. The floor is yours.
Thank you very much, Robert, for that kind introduction. I will just pull up my slides, get my slides set, and then we can begin. So thank you again, and thank you for the opportunity to come and speak to this group today on surveillance activities for highly pathogenic avian influenza and what we've done specifically here in Canada. Bonjour tout le monde, bienvenue. I would be pleased at the end of this session to field your questions in French and English, as I've come from New Brunswick, as was stated, and am bilingual. However, the presentation will be in English, and so without further ado, highly pathogenic avian influenza has been, front of mind for a lot of people, particularly myself and those of us who work in surveillance, as it has really become sort of at the forefront of a major animal health and public health issue that we have been facing. And so I was asked to speak about surveillance, one of the very, very important steps in addressing this disease and any other disease of note. Interestingly enough, I'm giving this talk twice today for another group a little later on. So if you are attending that second talk as well, will be very similar, but always good to hear information twice for some topics. As they gave their land acknowledgement, I would like to give my land acknowledgement. So I come from New Brunswick. We live, work, play, and operate a dairy farm in New Brunswick, and so I want to acknowledge that the land that we do all that on is the traditional unceded territory of the Maliseet, which is territory covered by the Treaty of Peace and Friendship. And the Maliseet are an Algonquin-speaking First Nation of the Wabanaki Confederacy. They're the indigenous peoples of the Wollastock, the very beautiful Wollastock River Valley, also known as the St. John River Valley, and its tributaries, with territories extending across New Brunswick and into Quebec and parts of Maine. Quick conflict of interest. I don't have any financial relationship with any for-profit or not-for-profit organizations to disclose. This information is freely provided as part of the work that we do within CAS. I will say, though, as was stated in my introduction, I did grow up on a dairy farm, and so the dairy industry is very near and dear to my heart. It's a very important industry to me, so I like working in things related to this industry. And I like to see success from the industry, the dairy industry, particularly in Canada. So quick presentation outline. Today, we're going to talk about some Surveillance 101. You got a little bit of that, what disease surveillance actually is. So that was already covered, but I will cover it again. Then we're going to dive right into the highly pathogenic avian influenza outbreak from the US and what the US situation currently is at. Then we're going to dive into Canada's surveillance efforts. So sort of the meat of the presentation will be what we were able to do and what we were able to accomplish in Canada based on some of these efforts. And I really want to highlight the most important part of this presentation to me is that this is a success story within Canada. Like, this is a major success story. I think a lot of us could use some success stories, certainly some national collaborative success stories that we've had. And this is one of those big ones that I really want to emphasize throughout this presentation, that this was a success, why this was a success, and how this has benefited us across the One Health sector within Canada. We're going to end off with a bit about how you can participate, a bit about what actually we do within the Canadian Animal Health Surveillance System, and then we will move on to some questions and discussion. And so with that, some epidemiology 101 basic terms. You heard the terms for surveillance. Epidemiology is what I do. It's what we do within CAS, what a lot of our stakeholders do. And so that is to study how often diseases occur in different groups of people, different groups of animals, and why. So how these diseases move through different populations, and what are the risk factors associated with those. Disease surveillance, as was mentioned, is an information-based activity involving the collection, analysis, interpretation, and sharing of large volumes of data originating from a variety of sources. And this is really what we do within CAS. So information-based activity, collecting as much data as we can from as many different sources as we can, analyzing and synthesizing that data into usable formats, interpreting that data through our network of networks with subject matter experts on the topic that we are covering, and then sharing what's relevant, what's important, tidbits out of that data back to the relevant stakeholders and the key players in any particular area. So highly pathogenic avian influenza, again, is a very good example of that. And within disease surveillance, CAS worked within, across all of those terminology definitions of disease surveillance. And then I wanted to highlight One Health. We all try to work in a One Health mindset and One Health framework now in a lot of these issues that we address. And so One Health is the feeling that the health of humans, domestic and wild animals, plants, and the environment are all closely linked and interdependent. And if you ask me, I don't think there are many better examples of a One Health disease than highly pathogenic avian influenza. Like, it really fits the definition of One Health in the fact that it can affect human health, domestic animal health, wildlife animal health. It's driven by changes in the environment. The effects that it has on our agricultural systems also affect the environment. It really is a prime example of One Health. And so you can keep these terminologies in the back of your mind as we move through this presentation and talk about how we address surveillance needs within Canada and how we ultimately got to the success that we are sitting at today. And so with that, we can dive right into the disease, which was first coined as the Mystery Texas disease. This disease on the 15th of March of 2024 generated some buzz in that cows in Texas were becoming sick, dairy cattle in Texas, with a disease that didn't fit the bill or didn't fit the clinical picture of any other disease that we would normally see in dairy cows. And this started to raise some concerns. Also, what raised some concerns is there was a large number of dead birds associated with some of these dairy farms. And around this time, so on March 20th, about 5 days later, the USDA detected avian influenza for the first time in livestock in the US. So this was the detection in Minnesota in goats. So there was a little bit of buzz around avian influenza. And of course, there was some suspicion that this could be avian influenza. And on March 25th, the USDA did confirm H5N1 to be the cause of this illness in Texas. And specifically, they identified this as the B3.13 strain. It's important to note that B313, a different strain of highly pathogenic avian influenza. So when we refer to the dairy strain, we're referring to the B313 strain. Interestingly, again, that happened on March 25th, the identification. On March 24th, our networks within CAS heard that the samples were positive for influenza A. And so we notified the Canadian Food Inspection Agency that there was a high possibility that this Mystery Texas disease that we heard about on the 15th of March could be highly pathogenic avian influenza, which it was ultimately confirmed to be. But as a result of the strength of the connections of those networks, we had information, suspicion, were able to identify a risk, and just had one additional day to prepare and implement strategies for Canada's response and what this could ultimately develop into. As a result of that, on the regulatory side, Canada was able to put in place restrictions on the importation of dairy cattle from the US in a very timely manner, which is one of the big reasons why we don't see highly pathogenic avian influenza in dairy cattle in Canada today. So, as I stated, the disease was first detected in Texas. This is a map of the current situation that the US is dealing with. You can see that they are up to 939 on this map. They're about 944 actually today. Confirmed cases. The outbreak is currently confined to California and has slowed down significantly. But you can see by this map, after that initial confirmation in Texas, the virus was able to spread very rapidly to many states across the US and affect many different dairy herds. After the identification in Texas, we started to see the virus migrate north. So following Texas, New Mexico identified positive herds, and Kansas identified positive herds. Then it spread a little bit more widely. So North Carolina came into the picture and South Dakota. In South Dakota, we were thinking, okay, that's getting a little close to the Canadian border. After that, multiple states became affected, but the big ones for us were Michigan and Minnesota. So these two states are very concerning. They are very close to the Canadian border. And at this time, we did not know, apart from individual animal movements, what the primary vectors of spread of this virus was. We weren't sure if it was being spread by birds, if it was being spread by other vectors, other than the movement of animals between state to state. We did not know. And so with that lack of knowledge currently, and while we were awaiting the epidemiological reports from Michigan on what was most likely causing the spread between herds, we were highly concerned because just a little bit east of Michigan in Ontario is a heavy dairy area. So the Stratford area of Ontario is right there. And so we weren't sure what was actually going to stop the virus from moving into the Stratford area and affecting Canada. After that, the disease continued to spread across the US and started to affect the poultry industry as well. And so multiple different flocks of birds became affected with the B313 dairy strain. The virus is devastating in poultry, requires complete depopulation of the flocks. And so the poultry industry in the US started calling for more surveillance on the dairy side because they were directly being affected by this virus, which affected the dairy industry, but was currently not well surveyed in the US. And so throughout multiple meetings with multiple stakeholders and associated groups in the US, it was identified multiple times that poor surveillance was a primary limiting factor to the US's response and control of the spread of this virus. And certainly, it's very difficult to ramp up surveillance during an active outbreak of a novel virus. We've seen that before with COVID. Similar situation here. An unexpected disease in cattle started to spread pretty rapidly. Difficult to ramp up surveillance in that case, but surveillance was definitely the most limiting factor. So we identified the need to be prepared in Canada very quickly. And we started working on that as quickly as possible through multiple stakeholder groups. So what were we able to do in Canada? Well, first thing we did is that the Canadian Animal Health Surveillance System, so those of us working within Animal Health Canada, quickly convened what we called the Highly Pathogenic Avian Influenza Scientific Working Group. And you can see multiple different stakeholders in this group. The Canadian Food Inspection Agency was heavily involved. Their cooperation in this group, these discussions were greatly liked. Public Health Agency of Canada was involved. This was identified as a potential zoonotic disease and One Health issue. So Public Health Agency joined these calls. The Office of the Chief Veterinary Officers of multiple provinces were on these calls. Provincial vet epidemiologists from all across Canada, as well as representation from all of the regional health surveillance networks. And a big key factor here is that we also had the dairy industry representatives on their animal health side join these calls as well and be part of these discussions. Environment and Climate Change Canada were part of the discussions, as well as the Canadian Wildlife Health Cooperative. Again, HPAI is a huge One Health disease that affects multiple sectors. And the more stakeholders and the more sectors you can get represented on these calls, the better. And so very quickly, this group identified surveillance as a top priority. We were able to leverage the strength of our network of networks to engage all or almost all of the stakeholders into these meetings, which really helped focus and discuss any work. It allowed people to voice their concerns and opinions, and allowed the right people to listen to those concerns and help address them from a regulatory standpoint. Animal Health Canada, through our work with our emergency management division, was also able to convene an industry discussion group, which brought together other implicated industries. So we wanted poultry at the table as well, based on the reports from the US that poultry was heavily affected. We wanted poultry at the table as well to be part of those discussions, before something happened or before plans were put in place, so that they could be heard as well. Further beyond that, beef and the swine industry were also invited and also participated in these discussions as potential industries that could be affected. We weren't sure at the time what effect this disease was going to have on beef cattle, and we all certainly know that the pork industry, when it comes to influenza viruses, is at a high risk and becomes a high risk for reassortment of those viruses with other novel flu A viruses. So very quickly, we convened this group. We recognized the need for surveillance. And what did that lead to? Well, the first thing that CFIA was able to do is that they were able to undertake retail sampling of milk products across Canada. And so all testing that I'll be referring to in this presentation is PCR testing. PCR is a highly sensitive test. We already had PCR capabilities for testing affected chickens and turkeys with highly pathogenic avian influenza. So they very quickly verified the use of PCR on samples like milk, and then we were able to test for that. So all the testing is PCR. It's highly sensitive, and then any positive results would have to go to the CFIA laboratory in Winnipeg for confirmation, but we didn't get any positive results, as you'll see. Now, admittedly, this isn't the most sensitive or representative form of surveillance, and anybody participating in the group discussions knew that. Testing retail milk, it's hard to know what representative sample you're getting by pulling products off the shelves. And everybody knew that this wasn't going to be the end goal of our surveillance in Canada. This was something that CFIA was able to do very quickly. They had the regulatory authority to do this, and it very closely mimicked what the Food and Drug Administration in the US was doing with their retail sampling. So we wanted to be similar to them and take similar steps. And in the US, what they found was that 1 in 5 samples collected from retail milk was positive for HPAI. Again, this is PCR, so they found genetic material. They didn't find live virus until they started testing raw milk samples a bit later on. But 1 in 5 samples collected, that's quite a bit. So in Canada, we wanted to get this rolled out pretty quickly. This was all handled by CFIA. And as you can see, about 1,200 samples across Canada, nice representative at least of the different regions, and that all came back as negative. Further to this, we ramped up passive surveillance. So we really pushed out information on what the clinical signs of the disease were, what should tip veterinarians in the field and dairy producers in the field off to what an outbreak of highly pathogenic avian influenza could look like in their herd, and then how veterinarians and laboratories would go about getting those testing samples, testing and reporting of that. So that was all ramped up pretty quickly. Active retail milk surveillance and passive boots on the ground field surveillance were able to be rolled out pretty quickly. Again, all negative, couple suspicious herds that ended up being reported, but ultimately did not test positive. And then further to that, after the retail testing, we were able to take our time and convene more in-depth surveillance meetings. So beyond the retail testing, what was our ideal surveillance strategy in Canada going to look like? And I'll tell you that at this time, the US did not have their national surveillance strategy in place. We actually rolled out our national testing surveillance strategy a couple days ahead of the US rollout of theirs. Which was good to see, but we didn't have the guidance of the US to go on for this one. So CFIA, because highly pathogenic avian influenza is a reportable disease in Canada in any species, CFIA took the lead on these surveillance meetings, but we maintain that multi-collaboration, that multi-stakeholder collaboration, and that multi-jurisdictional approach across all sectors. And so CFIA, along with representatives from Dairy Farmers of Canada and the Dairy Processing Association of Canada, with guidance from external stakeholders, were able to develop the framework for gathering and testing milk samples at the processor level using raw milk from the milk trucks. So milk trucks go to every dairy farm, they pick up milk in bulk, they fill the truck, they take those trucks to the dairy processor that they're supposed to go to, and we were able to get samples from those trucks as a representative sample of all the farms contributing to the milk in that truck, and then test that milk. The USDA developed a similar strategy, which you'll see on the next slide, but they tested the silos at the plant. So instead of testing the trucks, they tested the filled silos. Again, PCR is very sensitive, so there was no concern about dilution here. Pretty much one positive cow would spike a milk silo or a milk truck to have a positive result. Through the collaboration with industry, they were able to onboard a couple processing plants and then roll that out to multiple other processing plants as they sort of worked out the kinks. So they had a couple plants in 1 week, the next week they had more, and then by week 3 we were pretty much up and rolling with this surveillance strategy, testing raw milk from the milk trucks in Canada. CFIA also convened a cooperative discussion group with the Veterinary Surveillance and Epidemiology Network, which typically consists of chief veterinary officers from the provinces and the provincial vet epidemiologists, as well as those of us representing the Canadian Animal Health surveillance system. And so this group, along with the discussions from the industry group, focused on what we would do, what surveillance initiatives we would put in place if there was a positive test. So if we identified a positive dairy herd, how would we approach surveillance then? If we identified a positive poultry herd with the B313 strain, how would we approach surveillance then? And if we identified, say, a human individual with the B313 H5N1 strain, how would we approach surveillance in all those different scenarios? So to multiple different groups, the refinement is still going on, as one would expect. But the national surveillance testing of the raw milk from the trucks is in full swing and is working quite well, which you'll see a bit later on. So what did they do in the US? So as I said, these national testing surveillance strategies were rolled out at a similar time. We were a bit ahead of what they did in the US. But of course, they had to roll this out across 48 of the lower states, whereas we only had a couple provinces. And they were in the middle of an active outbreak, whereas we had the advantage of time without having any positive herds. So what does their national milk testing strategy look like? Just to give some examples and some comparisons, the US began national plant silo testing. So they took raw milk from the processor silos at the processing plants and tested that also with PCR. This allowed them to determine individual state status. So they wanted to determine the status of each individual state, whether it was positive or negative. If a state was found to be negative, then they moved to stage 4, which is absence of the disease in that state. If they were positive, they moved to stage 3, which allowed the individual state to detect and respond to the virus as an affected state. So it would then be on the individual state to go test each individual bulk tank of each different dairy operation in the state, find out which ones were positive, quarantine them off, and get the virus under control and get to a negative state. Once all states ultimately got to phase 4, then the US moved to phase 5, which is complete national freedom from the disease, which is still the goal of their national milk testing strategy. So again, you can see it mimics the Canadian system in that they're testing raw milk at the processor level, much more logistically and regulatory easy to get those samples, as opposed to requiring individual dairy farms to submit samples from their bulk tanks multiple times a month to get the same level of testing. The big difference is that they are doing things at the individual state level, whereas our approach was a bit more national and collaborative. So this is the current USDA map, what they have been working with their national surveillance. And so you can see some mixed results. So any of the purple states are moving through the phases but have not been detected. The blue states are positive, so you can see a smattering of positive states still across the country, including Michigan, Texas, where the whole thing started, and as I stated, California, where the bulk of the new cases are coming from mostly. Some states, only one state actually has gone to stage 4, which is unaffected. That's Mississippi, relatively small dairy industry there. The issue comes with some of these white states. And so these are states that have been holding out on testing. They're not participating in the national strategy. And so we ultimately don't know what the status of those states is. And you can see these holdout states really can greatly affect a national strategy to try and identify and determine what each state status is, and ultimately what the status of your country is. And so this has been ongoing. These states are still not tested as part of their national strategy. That is something that we really wanted to avoid in Canada. We didn't want any holdouts, right? If we're going to test nationally, we want the results to represent the whole country. We don't want gaps and unknowns here. So we hope in the US that these states eventually come on board and get tested, and that they can get a national surveillance strategy, fully underway. But as of now, about 2 months into their national testing strategy, these states have not come on board. Wisconsin is one particularly concerning state because Wisconsin is a very large dairy industry, the second largest dairy industry in the US, and the largest dairy state in the closest proximity to Canada. So going back to Canada, what results did we have? Again, you can see representation from all different regions, Western provinces, Ontario and Quebec being our largest dairy provinces. Each province represents a very large proportion of our dairy industry. And then my hometown, the Atlantic provinces, as well. We were able to test, all of these raw milk samples from taking samples from the bulk trucks, and they all came back negative. So the Canadian surveillance strategy, once it was rolled out, was very successful. We now have the ability through this testing mechanism to detect highly pathogenic avian influenza at a 0.1% prevalence. So there's about 9,500 dairy farms in Canada currently. So we would detect the disease if less than 10 farms were affected, which is pretty good. You can see many herds affected in the US. If we had 10 herds affected, we would be confident that we would be detecting it. And so far, everything has been negative. And what's even better than all of this really is that we have now developed the framework for the dairy industry to conduct national bulk tank milk surveillance for any disease outbreak. So let's say foot and mouth hits Canada and spreads across multiple different provinces or multiple different regions. We already have this framework in place. The logistics are worked out to continually test, bulk milk samples from the processing trucks for that disease. Or let's say it was another novel virus or a different reassortment of highly pathogenic avian influenza that wasn't the B313 strain, but found its way into cattle and affected them. This testing surveillance framework now is all worked out. It's being, tabletop exercises, going through, all the logistics to making sure we have the appropriate tracebacks for the samples if one of them ended up becoming positive, making sure that we're still able to get samples to labs on time, and continue to get a good representation across the country. So this testing is still ongoing, being led by the Canadian Food Inspection Agency, with support from all of the various stakeholders that I listed earlier on in the presentation. And it doesn't stop there. So what other activities have we done in Canada? There's been a lot of them. Again, a highly pathogenic avian influenza as a One Health, potentially zoonotic disease has spurred a lot of action across multiple different sectors and multiple different stakeholders. And some of those things include this entire list you can see on your screen. So again, I want to reiterate that all of these initiatives are collaborative multi-stakeholder approaches. We have federal, provincial, territorial, industry representatives participating in each and every one of these initiatives, as well as the Canadian Animal Health Surveillance System and Animal Health Canada. So what we were able to do through work done by the Community for Emerging and Zoonotic Diseases, which is a scientific branch of CFIA, was do a risk assessment for Canada. So they did a rapid qualitative risk assessment. What was the risk of highly pathogenic avian influenza to Canada, given what it was doing and how it was spreading in the US? Ultimately, that risk was found to be high. So we very quickly recognized that this was a high risk and something that we needed to prioritize. Within CAS, we focused on education, surveillance, and data synthesis. So we wanted to get as much information out to the field as we could, make sure field veterinarians were aware of what the symptoms were, what the signs were, who they were supposed to report to if they had a suspicion, what tests they were going to take, and how they should prepare for a potential infection with HPAI in a dairy herd, so that there was nothing hiding and that people weren't caught unprepared. Surveillance efforts with support through the CFIA, as I already detailed, and then data synthesis and dissemination back to all of our different stakeholders. So we wanted to, help out with all the collection of data, lots of scientific publications coming from the US, lots of federal and state government reports coming from the US. We were able to help synthesize that data and get it to the hands of various different stakeholders so that they could use it without having to go through all the data themselves. Biosecurity was recognized as the key risk factor, the key prevention step that everybody should take. And so Animal Health Canada, along with collaboration from the Dairy Farmers of Canada, focused on enhancing biosecurity on farm, ramping up PPE for on-farm workers to prevent any spread into the farms and any spread on the farms from the cattle to potential workers as well. So those resources were all developed and sent out. CFIA worked on their response, which is sort of comically called the DERP, which stands for the Dairy Event Response Plan. So now we have a response plan developed by CFIA with the Office of the Chief Veterinary Officers of each province for what the response would be if there was an individual detection on a dairy farm. PHAC worked on a lot of public health guidance around avian influenza in general, how to protect yourself, how to stay safe when interacting with wild birds, what to do if you come across dead birds, what to do if you think you've become exposed or sick. The Canadian Wildlife Health Cooperative has continued to do their dead bird HPAI surveillance. So any dead birds that are found can be submitted to the Canadian Wildlife Health Cooperative for HPAI testing, so that we can monitor the prevalence of the disease in the wild bird population, see if it's increasing or see if it's decreasing, and see if the risk to our agricultural sectors, primarily poultry, as well as people, is also increasing or decreasing. And along those lines, Environment and Climate Change Canada does environmental surveillance for HPAI. And we're currently working on something that's really cool, some sort of new future technology stuff, is that we're working on developing an AI-driven early warning system for avian influenza. So this is being done in partnership with the Dalla School of Public Health at the University of Toronto, so that we could potentially use a predictive model to predict when we may see an outbreak of avian influenza. So sort of 2 weeks ahead of the outbreak, the model will let us know that conditions are lining up that suggest that there could be an outbreak of avian influenza, which would be really cool if they can get that to work. If we know 2 weeks ahead of time that there's going to be a high risk of avian influenza, that would really allow us to ramp up surveillance in response activities. So the last bit of the presentation, I just want to go through what actually is the Canadian Animal Health Surveillance System. So all of those initiatives that I just outlined on the previous slide, CAS is involved in. So either we're collaborating with, leading, or supporting all of those initiatives in there. And so that should lead to everyone on this call at least wanting to know or should know a bit about what CAS actually is, because we often work sort of in the background of a lot of these things and aren't known by everyone, certainly not everyone who works in a One Health space. So the next couple slides just going to be what is the Canadian Animal Health Surveillance System. And as you heard, CAS is a division of Animal Health Canada. Animal Health Canada is a group with 3 divisions. The National Farm Animal Care Council generates codes of practice for animal care in Canada. Our emergency management division prepares for animal health emergency scenarios within Canada. So they're doing a lot of work on foot and mouth, a lot of work on African swine fever, and now a lot of work on avian influenza as well. And then CAS supports the surveillance, is the surveillance pillar of Animal Health Canada. So we work in animal health surveillance to support effective, responsive, and integrated animal health surveillance in Canada and contribute to Animal Health Canada's shared goal of advancing animal health and welfare in Canada. So how CAS works, as I alluded to, we're a network of networks. And so CAS is essentially participation from multiple different networks, all joining together and sharing information, sharing subject matter expertise, sharing clinical thoughts, sharing opinions, all throughout the network of networks. And so by leveraging the power and trust within these networks, that's how we were able to quickly identify HPAI in dairy cattle as a threat to Canada. That's how we were able to engage in the activities that were able to take place. And that's how we were able to identify the risk, ramp up surveillance, and have all of the stakeholders at the table in these discussions within Canada in regards to the emergence of this novel virus in dairy cattle in the US. And so what is our mission? Well, within CAS, we bring together and use data-driven information to demonstrate animal health, to minimize impacts of disease, and guide planning on national animal health priorities. And I'm proud to say, with HPAI, we accomplished all 3 of those things within Canada. We were able to demonstrate the status of Canada's dairy herd. We were able to minimize the impacts of disease, and we were able to guide planning both at the federal and the provincial level on this national animal health priority. And so, as I said at the beginning, this is a success story, and I want to end with that thought as well. From surveillance to action to success. So what does this actually mean? And what are the steps to success? So early threat detection and identification. Our networks were able to identify this as an early risk, as a threat to Canada, and something that we needed to ramp up and prepare for really quickly. Doing a risk assessment. So what was the risk to Canada? Is the risk high, or is the risk low? Is the risk negligible? Obviously, we can't prepare for every little outbreak and every little risk that may come out globally. So we need that risk assessment to determine, which ones we want to focus on and prioritize. This was one of those, which was high risk. Collaborative action plan, implemented and put in place by multiple stakeholders, rolling out that action plan. And then the stage we're at now is refinement. So how can we refine that action plan? Working out the final few details. Everyone is currently working on that right now. And so what does that look like? What is the picture of success? Well, unfortunately, for a lot of us who work in surveillance and in disease management and disease prevention, success often looks like nothing. And that maybe is a bit of a problem because nobody sort of sees what the success actually was, because nothing happened. And that's great. As I'm really happy to report, as of today, January 28, 2025, Canada has not seen an incursion of highly pathogenic avian influenza in our dairy herd, despite being identified as high risk. It got very close getting to Michigan, but didn't find its way into our country. And so what does that mean? That means that there was no negative impact to our dairy industry. There was no negative effects on trade. There were no spillover events of B313 into poultry, no spillover events into cats, which I didn't really talk about, but cats are another species highly susceptible to this disease. And there was no sick farm workers with HPAI, the B313 strain in Canada. So as I said, that's a whole lot of nothing, but those are good nothings. There's also a lot of questions. I have a lot of questions with HPAI in general. There's a lot of gaps in control at the poultry level. We've controlled this virus in cattle to this point in time. In Canada, we're still struggling with outbreaks in poultry of a different strain. And the US is really struggling with outbreaks in poultry. And then I also wonder what this would have looked like if HPAI, the B313 strain, had have hit our dairy industry first and not the US's. Would it have been the same success story? Certainly, I think we still would have leveraged the strength of our networks. However, it's a very different scenario when you're in the middle of an outbreak than when the outbreak is happening somewhere else. But ultimately, this was a success story. And I just want to end by acknowledging that CAS, our division, is funded by the Agri-Assurance Program under the Sustainable Canadian Agricultural Partnership, which is a federal, provincial, territorial initiative. And with that, I will turn it over to any questions.
Well, thank you so much, Dr. Gillis, for sharing your expertise and knowledge on the Canada surveillance effort for highly pathogenic avian influenza. It's definitely nice to hear, a success story, and it's very important for when you highlighted sometimes nothing is great. So we will now begin our discussion period. Please send in your question for Dr. Gillis using the Q&A tab. You can find it at the bottom of your Zoom window. You're invited to ask questions in your choice of the official languages. By going to the Q&A tab, you can also choose to upvote other people's questions. Everyone is welcome to participate, and we will try our best to address as many questions as possible. However, given that we need to wrap up by 2 p.m. Eastern Time, we may not be able to get to all of them. So we already have a few questions coming in. I'm going to start with the first one. So given the political climate in the US, including the threats of US pulling out from the World Health Organization, how do you foresee this impacting surveillance of highly pathogenic avian influenza in North America? And will surveillance in Canada be scaled up proportionally?
Yeah, that's a great question, and something that has been sort of on everyone's mind working in surveillance, given the changes in that political climate. Certainly the restrictions on the sharing of information from US government federal organizations like USDA, FDA, and CDC have resulted in a bit of challenge of information and verifiable information coming out of the US. We've been working on HPAI for a while, and we are still leveraging the strength of some of those networks with unaffiliated groups in the US. So bovine practitioners, the US laboratory information system, anyone who is not restricted by the federal moratorium or the restriction on information sharing. So it will most likely have an impact, certainly on verifiable information, but as far as sharing of scientific information, publishing of findings, and research efforts related to HPAI and surveillance in the US, I don't foresee too many disruptions coming from those sources. They're still highly engaged and highly motivated.
Thank you. The presentation has been focusing on the dairy cattle. So is there HPAI surveillance happening with beef cattle?
Yeah, so there's no formal surveillance system in place for beef cattle apart from passive surveillance. So any suspicious clinical symptoms, they're able to test beef cattle. If they are moving beef cattle across, they're encouraged to test them. But there's no formal surveillance system for beef cattle currently. However, as I said, beef were involved in these discussions right from the beginning. Anybody working in the beef industry was briefed on HPAI, what was going on in the dairy industry, what signs they should look for. In the US to date, even in the midst of their large HPAI outbreak in cattle, have not detected it in beef, and they've had one sort of sporadic detection in cull dairy cows at a meat packer processing plant. So the risk to beef was considered to be relatively low, and we wanted to focus on dairy. So it's a yes and no answer. Beef has been included, but no formal surveillance.
Wonderful, thank you. The next one is, I guess despite the early detection and early action, what else prevent the incursion of HPAI in Canada? Will there any regulation in regards to our contact with the US dairy cattle?
Yeah, so there's a couple things that I think prevented the incursion of HPAI in cattle in Canada. One, I really believe that CFIA's swift action and restrictions on the importation of dairy cattle played a big role in that. A significant number of US dairy cattle come up into Canada from the US. It's not large volumes. There's larger volumes that tend to go south. But the restrictions, the restrictions put in place on the shipping of those cattle, the testing requirements put in place by CFIA, and on Canadian cattle going to the US and coming back, I think played a big role in not seeing HPAI in our dairy herd. Further to that, identifying significant risk areas. So cattle shows, agricultural fairs were identified as a significant risk area. So there's big shows in the US, there's big shows in Canada. There's cows that go from both countries to both of those shows. And so getting information out, discouraging participation in those shows if it was possible not to go, getting the message out, again, identifying the risks, the symptoms, and making it clear what potential impacts the disease could have on dairy herds in Canada really helped to limit that risk as well. And the last thing I think we did get a little lucky because it's hard to say what the actual situation in the US was, what cattle were being shipped up during the time when the virus was being confirmed, when the discussions were taking place. There's certainly a little bit of luck component to that as well, but definitely the steps taken really helped to prevent this virus from moving up. And we may see it still, it might find its way up to Canada. It's not a guarantee that it won't ever get here. But we've had a year now to prepare. We've planned, surveillance is ramped up, and we didn't see it sort of in that critical time period. So,
thank you. Definitely a lot of Canada's effort in surveillance in doing this. The next question that we have that has quite a bit of upvote is, how would you trace back a positive HPAI result to the farm level, given that raw milk from multiple farms is mixed at the processing plant?
Yeah, so that's the result of the tabletop exercise. What's pretty nice, again, is we're testing individual trucks. So if we have a positive milk truck, then we know which dairy herds contributed to that truck. If it was a silo, it's a lot more herds contributing to the silo. Now, they have bigger herds in the US that can fill a silo with less herds. We have smaller herds in Canada, but they do have the ability, once they test the truck, if that truck tested positive, we would be able to identify which dairy herds contributed to that truck. And then we would go identify those dairy herds and test those dairy herds using the bulk milk from those dairy herds. Once they were positive, then it would activate the dairy event response plan, which would test any dairy herd within sort of a kilometer radius of that herd for a full surveillance response. So the truck, we know which herds contribute to that truck. It was one of the limitations with the retail sampling. It's really hard to find out which dairy herds contributed to a retail sample. But which dairy herds are filling a dairy truck, we have that information. The dairy industry has that information, and we can trace those back pretty readily.
Thank you. So now we're going to kind of shift a little bit talking about emergency management. So from the emergency management perspective, to know the reason for some of the states that you mentioned that did not participate in the national strategy. For those states, do you happen to know whether they had the state strategy? Could that just be they wanted to avoid the national regulation? Do you have any insights on that?
Yeah, some of those states are politically motivated. Holdout states, they didn't want to participate in any federal testing strategy. They didn't want to cooperate with the current administration. Other states, like any state with a recognized state level strategy, has been included. So Colorado, for example, had their own state level testing strategy that was accepted by USDA. So any of those states, some of those states that haven't been tested yet, are what we call political holdouts. So they did not want to participate. Other states, I think, like Maine, for example, which is very close to the New Brunswick border, but just a smaller state with a much smaller dairy industry, I think they're just waiting for the other states to get rolled out. So from the US, I don't see that being avoided at the national or the federal level. This was a federal order in the US and they didn't want to cooperate with it. But our goal is to make sure that we do avoid that within Canada. We have much more collaboration, much more cooperation between the provinces. And because our dairy industry in Canada is a national entity with supply management, we have much more cooperation from the dairy industry and the dairy processors.
Thank you. So this is a follow-up question to the beef industry that you have answered already. So you state that there have not been any detection of the HPAI in the beef cattle. Do you have any idea as to why it's affected dairy cattle and not beef?
Yeah, again, some ideas, nothing concrete and no direct epi links. So one of the proposed mechanisms of spread of this virus, and I didn't talk about the clinical signs of the virus, but it causes a mastitis. So in the dairy cows, it seems to affect them through the milk, dries up the udder, causes like a thickening of the milk into sort of like a mastitic event, what we would call, and also has a respiratory component spread to it. And so the milk spread possibility definitely would explain why it would be spreading through dairy and not through beef, because we're not milking beef cows, but we are milking dairy cows. And so that exposure, the potential exposure through the milk would definitely drive spread from dairy to dairy, and you wouldn't see that on the beef side. The respiratory component of this virus is harder to explain, but dairy cows tend to be kept in more confined areas in a barn, inside with sometimes not the best ventilation, whereas beef cattle tend to be kept outside in controlled groups with less nose-to-nose contact. And so the spread through the respiratory mechanism also would most likely be driven just by the dynamics of the dairy industry. And beef seem to be just less at risk to those general risk factors or those mechanisms of spread. Why we haven't seen it at all in beef cows, I don't know. Nobody seems to. We don't have those epi links. Not sure, but the risks are definitely higher and much more significant with the frequent nose-to-nose contact and the milking exposure of dairy cows when compared to beef cows.
Well, thank you so much, Dr. Gillis. I feel we're going through a round of rapid questions. That was a lot of questions that you were able to address in a short time. So we did get a lot of questions, but because of the time, we have to conclude today's session. Just a second. Yeah. So I would like to begin by thanking all of you for joining today's seminar, and of course to our speaker, Dr. Gillis. A reminder that for today's the recording will be available on the NCCID website in a few weeks, along with the presentation material. We will also like to encourage you to take some time to complete our survey for this presentation. You can scan the QR code on this slide, find the link in the chat, or look for the link in the email that will be shared with you shortly. Those will provide you with access to the survey. For those of you that require a letter of participation for your attendance, you will be able to make the request using the post-seminar survey as well. And for a future notes, please mark your calendar and join us for the next seminar on Tuesday, February 25th, from 1 to 2 p.m. Eastern Time or 12 to 1 Central Time. This seminar will feature the final report launch for Vision 2030. So at the Surveillance Advanced Seminar Series, we first introduced you to the Vision 2030 initiative at our very first seminar back in September 2023. And now the final report will be available on Canada.ca in the coming weeks. So for those who are not familiar with what Vision 2030 initiative is, it is led by the Public Health Agency of Canada, and the goal was to develop a vision for public health surveillance in Canada by 2030. So we welcome you to join us next month to learn more about Vision 2030. If you have any more questions about Surveillance Advanced Seminar Series, please visit our webpage at nccid.ca under the Surveillance Advanced Seminar Series for more information. So on that note, that concludes today's seminar. Thank you all very much for joining. And once again, thank you so much for your presentation, Dr. Gillis.